Let's get down to business. Now, the Consumers Federation of Kenya, Cofek, has moved to court seeking to suspend the new government requirement of travel health insurance mandatory for foreigners entering Kenya. The consumer lobby says the Ministry of Health has introduced the requirement without demonstrating compliance with constitutional rules on public participation, transparency, and fair administrative action. Brian George Otieno now explains why the Kenyan diaspora community needs to pay attention to this.
Cofek is seeking orders barring authorities from enforcing the requirement, pending determination of its petition, opening a legal battle over reforms affecting tourism, insurance, and cross-border travel. It has also applied for orders preventing the accreditation of insurers and collection of premiums until the court determines whether the scheme complies with the Constitution and the Social Health Insurance Act. The petition targets Gazette Notice number 11492, published on July 30th, 2026, which prescribes minimum benefits limits for inbound travel health insurance under the Social Health Insurance Act 2023 and its regulations. Cofek argues the notice effectively operationalizes a compulsory insurance regime for people traveling to Kenya. The legal dispute stems from government's implementation of the Social Health Insurance Act, enacted to overhaul Kenya's healthcare financing system. The challenged Gazette Notice prescribes minimum travel health insurance benefits limits under regulations made pursuant to that law. Parliament approved the Social Health Insurance regulations in 2024 as part of the transition from the National Health Insurance Fund to the new Social Health Authority framework. While industry players aren't against the set value of the cover of 6.5 million shillings, they admit this is likely to disrupt their existing travel insurance product. Customers may increasingly require comprehensive all-in-one solutions to ensure compliance with new legal requirements.
How I look at it probably would be they arrived at 6.5 on what they felt was sufficient cover for an emergency case. Because remember, it has various aspects in it. It has even repatriation. There's a few more bits in it. It can be very, yeah. So I think just a matter of adequacy, if you ask me.
Need for product redesign and underwriting adjustments. Existing travel insurance product may require redesigning to align with prescribed benefit limits and mandatory requirements. Increased focus on partnerships and digital distributions. Travel agencies, visa application channels, and digital platforms may become increasingly important. However, this new directive creates a new dilemma for the diaspora community who have active private insurance.
Some of them are Kenyans who stay abroad and they'll be coming back home visiting with their families. They have children, so they want to know, does this apply per person or per household at that?
My thoughts are it's applying per person. And then on your first question on guys who have their private medical insurance, I think this is more of a top-up because this only deals with emergency treatments. And this means, for example, is your normal, you come to Kenya and then you become sick, then you'll need treatment. That will be covered under this. But if you have a condition that you're managing, say, for example, a chronic condition, I don't think it will fall under emergency treatment.
In its final prayers, Cofek asked the court to declare government actions unconstitutional, to ban the whole Gazette Notice and compel the Cabinet Secretary to act in accordance with the Constitution and equally stop the mandatory implementation of these directives. Brian George Otieno, NTV, Nairobi.